get your IV setup out of the room. So you'll go ahead and get this, you'll prime it, you'll get it ready and everything. So this is ready. So it should have a cap on the end, but because we're in lab, it doesn't. It should have a sterile cap. You should always have a sterile cap on the end of this because this is sterile. It's going to be going into the patient. So I don't have it in here yet. I'm going to let it run freely into the patient and then put it in there. So the next thing I'm going to do is I'm going to find a bouncy vein, okay? And it takes me a little while to set up because I want to be successful on the first try. So I'll have them move to one side of the bed and hang their arm down off the side of the bed. I'll put a tourniquet on. I'll kind of slap that arm a little bit, look at it and be like, okay, that's a good one, but I'm going to go to this side and see if it's better. So I'll scooch over here, like let's hold this one down and see, and I'm like, oh, this one's good, but this one's straight and it's their left hand and they're right-handed, so I'm going to use this one. You get all your equipment and put it on that side of the bed. So first of all, I'm going to show you how to tie a tourniquet. I need someone with short sleeves, if you don't mind if I use you. Have I showed you tying a tourniquet yet? Okay. You guys have a tourniquet that you can use today if you want to. It's in your kit somewhere. And what I do is, I'll take my non-dominant hand and hold it like this, wrap it around, pull it around, that tightens it. See that upward X right there? I just lift and tuck so the little tabby things go up. So every time I know they're up and then I can do it, and I always pull this one and it comes undone. If I pull that one, it doesn't. If I pull that one, it easily comes undone. So pull it around with this one. See, I'm pulling it underneath. So I'm pulling around underneath, X, upward X, lift and press. So now I'm going to look for a vein here. I see one starting to come up here. I can see several in the hand. That will be easy to start in the hand, but your hand is more sensitive and they tend to fall out of your hand a little bit more. So maybe if you're a beginner, you can start in the hand, but I'd suggest finding these veins that come on up pretty quick. Jeez. So you guys won't be starting them in class today, but you can find each other's veins with a tourniquet in class, and that'll be good. So another thing too is it helps to hang the arm down. It helps sometimes if they're really cold, you can't see the veins, so if you'll put like a warm rag on their hand for a little bit, you can get it, or their arm. That's what I've done in the hospital. And you don't want to leave the tourniquet on too long, so maybe a minute, minute and a half. So what I'm going to do is I'm going to find this guy's vein. I'm like, okay, there's a vein. Well, now I know, like, okay, I'm thinking, I'm a beginner. It's going to take me a little bit longer than normal. I know where the vein is, so I'm going to take this off because I don't want to have it on for 4 or 5 minutes, okay? So you guys have an IV start kit. I like to economize. I'm sorry, but I'm just like, I don't like to cost the patient 1 extra cent. So I just get my own Catheter, but it's the same thing that's in your IV start pack. So I get that, I get these, I get them ready, and get some tape. I probably should even have in my pocket. And I'm going to try and find the edge of it. And I'm going to do about 3 pieces. They're about that long. Okay. Now I'm going to get the IV catheter and open it. And then it has these little grooves that you can hold on to right here. So I'm going to pull it out. Remember, pull straight out. And then I'm going to kind of just make sure that that's going to work there. So it's working. You see what I'm saying? Like, I want to make sure it pulls off okay. So I always do that. I don't pull it completely off, and then I'm going to stick it back in here because I'm not quite ready for it.
Is bevel up?
Bevel up on this. So that secures it. Ready for this. Hope I haven't forgotten anything. So it's easier to tie the tourniquet without your gloves on, but hey, if you can do it with your gloves, that's fine too. So I'm going to tie it because I know where I'm going to go. I'm going to put my gloves on, and I don't know what's going on with this glove, but it looks like there's only half a glove there, but I'm going to use it. And I'm going to take this, I'm going to feel that right there. I'm going to swab it from inner to outer. Now you'll see people come back, they'll do that and then they'll come back. Well, that doesn't make sense if you come back after you clean it, right? To touch it again. So don't touch it after you've cleaned it. So you're going to clean it from inner to outer and then put that to the side. Got this ready. I'm going to look the bevel up. And I'm going to take this, and I'm going to have to show you on I'm not going to stick a real person, but I'm going to show you how to hold the arm on a real person. I'm going to hold that kind of tense, and I'm going to stick that in, and if you're in the right place, you're going to feel a release of pressure. I don't know how to explain it, except that you're like, oh, I've got it in, because I can feel. So once you're in, you see a flashback of blood, which is just fake, so I'm not going to see a flashback of blood. I usually take that. See how I advanced that and I didn't move the needle? I just kept the needle there. I'm going to take this off because if I leave it on, when I disconnect this, blood's going to pour out. So I don't want that to happen. So does all this make sense so far? I can do it again in a minute if I need to.
I'm just trying to understand, don't we normally have to aspirate to make sure that we don't get blood return? Or are we supposed to see blood return?
No, you're supposed to have blood return because that says you're in a vein. So you want to be in a vein for this. Okay, so it's okay at this point, it's not going to bleed out because I have the needle in there. At this point, I'm going to take this finger and I'm going to occlude this. I'm going to push on the catheter because if I don't occlude it, it's going to pour out blood when I come out. The reason I use this finger is I want these fingers to help me. Does that make sense? So push that down, pull that out, and put that together, and then I can release. So now you're not going to have any bleeding because it's hooked up to this, which is already primed, and I can turn the IV on and I'll be like, okay, it's dripping, I'll look here, it's going in, it's not swelling up. If it was swelling up, somehow I missed the vein, and that's not good. You don't want it to swell up.
What do you call that?
It's called infiltration. And the way you can remember that is like in the Army, when an enemy infiltrates the camp, they're in a place where they're not supposed to be. So infiltration is where the fluid is in a place where it's not supposed to be. So I have this ready, and whoops, I better make sure that's on good there. You can kind of screw that down a little bit. There. So now I'm going to take my Tegaderm, and I'm going to, whoops, I pulled the wrong thing out. What am I thinking? I'm going to put that right on there. Pull this off, and it's secure and good. So now I'm going to put these, and this is a nice little lesson that I learned somewhere along the way. I'm going to rip that in half like that and make it skinnier, and then I'm going to put the sticky side up, and I'm going to put it under here, and this is called a butterfly, where you put one of the wings that way and one of the wings that way, and it stabilizes it right there. Cool. If you want it stabilized a little bit more, you can put that right there. And then I have a couple more left, so I'm going to maybe take one of these, put it, I like to put it right on top of the Tegaderm so I don't have it all the way up the arm. And then I'm going to take this and attach it to the inside of the arm. So if it happens to pull, it's going to pull from up here instead of right at the side. This is not going to come off of the human as easy as it did right there. So it has several places to pull from. So butterfly over that, sticky side up, and then put that down. And then when you do an IV push, that's called IVP, you're going to push fluid into the closest port. And you're going to push, you're going to do a flush before and after your medication, and your minimal flush. Do you guys remember what the minimal flush is? 2. So you can, since this is so close, you can flush 2 or 2.5, because a lot of times they come in a 5. So you can flush 2.5, and then your medication, and then flush the other 2.5, and your second 2.5 has to follow the timing of the medication. So let's say the IV is in, it's done, we're done with this, and someone's like, this patient's ready to go home, and you need to go take it out. So I'm going to get my gloves on, And I'm gonna turn this off first, so it won't be going, okay? And then I'm going to take an alcohol prep, and I'm just gonna pull that off so easy like that, because it works so well to do that. And then kind of pull this off all together, and I kind of do outer to inner on this too. So I get it, remember I'm supposed to have gloves on here too. So I get this all where it's just at the point right here, and I'm gonna get a little gauze or cotton swab. I'm gonna put it right on there, and this is not a needle, so I can press down on here. So as I take it out, I'm just gonna press down right there. And then I ask my patients, I'm like, I'm gonna put that there for just a second. I ask my patient to hold their arm up like this while I get rid of my trash and get them a Band-Aid